that was silly, ridiculous, a waste of time. They didn't want that's why they were so successful. That's why they got away.
Made a living in very dangerous.
This is really an integrated blue together.
Dianne Andrews in black and white.
Welcome to Dianne Andrews in Black and White, and I'm your host, Dianne Andrews. Thanks for joining us today, whether you're in our 3 million homes on television, on the CW21 in Baton Rouge, and down on Pelican Broadcasting down in New Orleans, Lafayette, and Baton Rouge. Our studio is in Baton Rouge, Louisiana. Or whether you're watching us on our YouTube, our social media handles are up on the screen as you look right now. I want to dedicate this show to Dr. Raul Ritard. He is our state epidemiologist who is under the weather, and I want to thank him for the years that he's done epidemics, pandemics, and infection control with us here at Dianne Andrews in Black and White. We did Zika together, we did Ebola together, we've done infection control and the homeless together. About just 4 months ago, we did that. So thank you, Dr. Ritard. But we've got a very good person who worked with him as his assistant for almost 13 years as the assistant state epidemiologist for the state of Louisiana. And you'll be meeting her. We're going to talk about precautions. We're going to talk about what trends she's seeing. And we're also going to talk to someone from Vital Oxide who's going to tell us about disinfecting surfaces. So what I want to leave with you in this beginning is, in the last 2 decades, 20 plus years, we've had 3 major pandemic viruses, SARS, MERS, and now the Covid-19. And we're going to talk about what does that really mean? What is that kind of virus with the doctor? As you know, in America today and around the world, 250,000 have tested positive and over 14,000 in America. And in our state here, 492 with 11 deaths. And we're the 4th in the nation, and the other states were much larger than the state of Louisiana. So let's talk about that. Some people have asked, why are things shutting down like California? Everybody has to work from home and everybody has to stay home, but they have not called it a shelter in place except in San Francisco. Let's talk about New York. New York Governor Cuomo is very complimentary to what's going on, but also very worried about what is going on and getting PPEs and the mask and everything they need, and the ventilators especially, to control this virus. We're going to talk about precautions from 6 feet away, social distancing. And you may wonder, well, what is she running for queen for a day? Is that why she has this crown on? Come on back and meet the 2 experts here. They're going to talk to us about how to save our lives, potentially, and not even get this virus, hopefully. And I'm going to tell you why I have a crown on. Come on back to Dianne Andrews in Black and White. Thank you. Welcome back to Dianne Andrews in Black and White. Thanks for returning. As you see, I'm still with my crown, and it's not queen for the day. Coronaviruses are nothing new. This COVID-19 is a coronavirus. And looks like a crown when the scientists look at it under a microscope. And so that is why I am queen for a day, or not queen for a day, but I wanted to show you what it looks like if you look under a microscope. With me is a person who looks under a microscope quite often. This was our former assistant state epidemiologist, Dr. Susanne Straif-Bourgeois. Now, you married a Frenchman. I know you're from Germany. Now,
yes.
Where's he today?
To be honest, I don't know. I hope he is at home and does social distancing.
Hey, I got 2 of them with social distance from. I don't know where they are either. But tell us about, I know you were from Germany, and you went to school over there, and you also went to Johns Hopkins. You have
Correct.
a PhD in epidemiology,
Yes.
and then you have an MS, Master of Science, and an MPH, Masters of Public Health.
Mm-hmm. Correct.
So you came down here for love, obviously. You were in school
No,
here?
I didn't come down here for love. Mm-hmm. I came down to get my postdoc at Tulane, and I worked on malaria at that point, worked a lot of overseas, and during that time I met my ex-husband. And then I stayed in Louisiana.
You liked it? You liked New Orleans?
Yes.
And as we talk a little bit about New Orleans, I guess that turned out to be kind of the first cluster and still is the largest in the state of Louisiana as far as COVID-19, correct, Doctor?
That's correct, yeah. We have the most cases at that point in the city of New Orleans or Orleans Parish, and also with the highest number of deaths, which are more or less clustered the death in a nursing home in New Orleans.
And I think 5 people died there, and we have 11 dead right now, and we hope nobody else has died from this disease. I was saying, we were talking earlier, this morning when I woke up, it was over 15,000 in the country, and with 210 dead, I think, still way too many, and then it jumped to 16,000, but the same number dead. So that's saying hopefully some places starting to flatten. Because California and New York, I don't think so though, yeah, California and New York have taken drastic measures. Do you think I know you're not a politician and you're not privy, but from your medical background, do you think we're headed to anything like shelter in place or everybody work from their home or?
Well, we already started that quite often, that people are supposed to work from home. We started to do online teaching so that our students don't have to come to the university anymore. Same is true for high schools, universities throughout. But I think what we have seen is that we really are very concerned about overburdening our healthcare facilities, including our healthcare workers. So we really need, because we still assume at that point we are not flattening the curve at that point. Nothing will happen. We are very close already at overburden our healthcare facilities. They're really almost at capacity. So at that point, it's very important that they need space. So they put tents outside the hospitals. The National Guard was called in to also help with screening of people who have signs and symptoms. We need personnel, healthcare workers who are actually not overburdened and stressed out because they have children and family as well. So we have to protect them. And then we need medical equipment because we assume that a certain percentage will end up in intensive care units, and we need ventilators and need other things as well. So we really have to focus on that, and that's when they are talking about flattening the curve. Flattening the curve is to really do social distancing, do curfews, do lockdowns, which I've seen in other countries in the world already, that really people do not infect each other, so that not in a very short time we have too many cases who have to be hospitalized, and that we don't run, as Italy has done, that they're overwhelmed, have to put all these very sick people out there, and we're running out of ventilators and other very important devices.
As you bring up Italy, Susanne, they found out the same day that America did about the beginning case in Wuhan. And, it was a little confusion, it seems, at the least on China's part to tell, was this a human-to-human transmission? We all know that it probably started in an animal, which 90% of the coronaviruses do. And we have the SARS, and we've had the Middle-East Respiratory System, the MERS. We've had all those in the last 2 decades, 20 years. And so by the time we had one person come over from Wuhan was on January 20th, and he was tested. They had already started to test people from Wuhan, China. And he was positive on the 21st, we found out. The next week, the president put the ban, and he was called xenophobic, and he was called racist for doing that. Italy did nothing, and they have a direct flight every day from Wuhan to Italy because they deal in textiles with them. Italy, Milan is a fashion capital of the world, so a lot of people are back and forth. They were talking about, and they never put the ban on. They have surpassed China with the number of deaths, over 4,000. There are 60 million people. China is 1.3 billion. We're 330 million. So, and they're higher than us in deaths, thank God. I think we've had 210 in America deaths, I think, out of 16,000 people testing positive. So in Canada last week, they stopped allowing us to come to Canada because Justin Trudeau, the Prime Minister, his wife is positive with this virus. As I say, this virus, and most don't, have no prejudice. They don't care young or old, because we've seen in Louisiana that even between 40 and 49, there's a large number of the positive cases that are not 70 plus here in this state. And they're seeing it more and more in Italy. They saw a lot of that, right, doctor?
Yeah.
Yeah, so it's not, people were saying, younger people, they are immune from it. I don't think they can say that.
No, we also have to consider, so we really talk about the people who are 65 and older who are at highest risk for severe diseases and need hospitalization and potentially have to put in an intensive care unit. But we're also talking about vulnerable population. These are people who have heart disease, who have diabetes, or actually have lung disease. And if we think about our Louisiana population, just thinking about our best estimate of diabetes, we know it's very, very common that you don't have to have only that age, but you might be also much more vulnerable to get severe COVID-19 than probably most of us.
Because I want to make it clear to people that it's definitely many more parishes, 26, I think?
26.
Out of the 64 parishes here who do have positive cases of COVID-19. So we don't want to make this a New Orleans disease, because I read the other day that Our Lady of the Lake, I shouldn't say, one hospital was saying that they didn't really allow some New Orleans people visiting guests there in the hospital, which I guess we all just need to take the precautions, take the temperature when they walk in the door, and make sure you give them some gloves and a mask to put on, which we're running out of, because in fact, Governor Cuomo was on today saying for PPE, if he knows companies that want to start making them, masks is pretty easy to make, right? I mean, here's one here. Here's some of the things we use. You know, when I was cleaning in here yesterday, we had our soap, we have our gloves, we have some disinfectant, we sprayed the air with some disinfectant, and we have our hand sanitizer. And I will tell you, I am, every time I go out, and that's not much right now. I try not to go out too much. My co-host here, Fuji Lane, is, when we go out, I even put a mask on him. And in saying that, doctor, I read that, and we talked about it briefly, in Hong Kong, there was a 17-year-old Pomeranian who tested positively for the virus.
Yes.
And there was, in Hong Kong news, they were saying the first dog dies of the coronavirus. But they can't really say that.
They cannot say that. Again, we have to remember that's one dog who was diagnosed, was infected with it. Also keep in mind that dog was 17 years old, so it was a really old dog. But what happened there is that actually the woman who owned the dog was positive for COVID-19. So, and then they actually tested the dog, but the dog did not have any signs and symptoms we assume was related to COVID-19. And I just looked up a couple of virologists who work in veterinary medicine, and they think, because dogs, cats are mammals as well, that they might actually test positive. But again, we do not know at that point, and again, that will change or might change, hopefully, because there will be got a lot of research going in, if that virus is actually able to penetrate the cells as it does in human cells. So the question is, what did the dog die of? We really don't know.
And she wouldn't allow an autopsy. The owner would.
Yeah. So, and again, just being tested positive, if you don't have any signs and symptoms, that just tells us that you were exposed to it. You don't have disease.
As we said a minute ago, this disease has no prejudice. Tom Hanks and his wife Rita Wilson, the actor and actress, and I mentioned Justin Trudeau's wife has it, and that's when he shut the border down to America when they got it. I guess before that, who cared, right? I don't know, but just probably happened to be timing. But I think one very strategic move we made was shutting that border down to Wuhan, and then to Italy and Europe 2 weeks ago, but to Wuhan on January 31st.
Hi, I'm Greg Williams. I smoked for nearly 30 years. Stopped smoking because of vaping technology. Grape drink on ice is my favorite one.
The Louisiana vaping industry employs nearly 2,500 Louisiana residents, generating nearly $500 million for the state economy. It's important that state lawmakers protect this industry that's helping countless adult smokers quit with less harmful alternatives.
Vapers, your ability to access flavors is under attack. Join CASA today and fight back.
March 9th begins Louisiana's legislative session The Louisiana Vaping Association is asking for your help. Please contact your representatives today.
What would you tell people the best things to do? We've talked about some precautionary methods here. When they go out, should they, one thing I had mentioned to you earlier, when I was going out to get my packages, you know, because I'm ordering everything now, right, even food. And when I go out to get them, I was just picking them up with my hand. And that was one thing that I had never heard anyone say till the other day. One of the doctors on the team, it may have been Dr. Adams, our Surgeon General, and they said when you go out to get your packages, you still need to, because you don't know what the person has delivering the package. And then you pick it up without gloves. It's the same premise on every surface, although now it's 72 hours for hard surfaces like my floor.
72 hours for plastic and stainless steel.
Non-porous, right?
Yes, and 4 hours for copper, because copper has this anti-disinfectant material, chemical. And they say about currently it's about 2 to 3 days on cardboard.
Even on cardboard, it's 48 to 72 hours.
Yeah,
also.
so that's
what that's where there's boxes of cardboard.
Yeah.
Okay. And the rhinovirus, which is the cold, it's 8 hours on the skin, I was reading, and the flu is up to 48 hours. And Dr. Felch said today that this is you're more susceptible or easier to get it because how long it lingers. He said 3 to 4 times more susceptible to the COVID-19. Is that what your research is saying?
So what the research says, when we look at how this disease is spreading, we know that it's a little bit higher than MERS. It's not as contagious as we have measles, as well as some other diseases. TB, much more contagious.
But are they surface also? Do they stay on the surface as this one does, or just person-to-person contact?
So think about chickenpox. We all have children. Yeah. Chickenpox is also very contagious because it's an airborne disease. Right. COVID-19 is not airborne, it's droplet. Therefore, we do the 6 feet.
It has to be the respiratory droplets. That's why the mask is
but
so
they are
good.
the big droplets, so they will fall down. So 6 feet.
Would this stop them? So, if somebody coughed on me, would that stop them?
So what I think is, and I think that's important to say, I would not advise anyone to buy a mask because we really need them for the hospitals and our healthcare workers.
I was in healthcare. I had it before.
But I wanted to make it clear to our viewers. Please do not go out and panic. We really need all necessary medical supply, especially in Louisiana right now, to take care of patients, but also protect our healthcare workers, and that it does not spread in healthcare facilities.
Now, but for people who may have some at home already, who've already done what you told them not to do, it does protect you from if someone coughs on you, they said this will protect you from the respiratory droplets. And also, if you pick something up, we're more likely to touch our face all the time, they said was a problem. And it's going to protect your eyes and your nose and your mouth. Yeah. Well, maybe not the eyes so much, but we usually touch around here.
Yeah.
And they said that this would help protect that. So make your own. They have hospitals look how easy this is to make. They have hospitals being, they're doing challenges for people to make 1 million
just to
masks.
Protect themselves.
Yes, because a lot of our supply chain, again, is not in America. A lot of it is out of China and other places, even our antibiotics and ingredients into some of our major medicines.
So I think if we think about our current Louisiana weather, I really would not wear that mask personally, even so I like to touch my face and I'm aware of it. Because think about, I'm going out down to get some groceries, have that out, I'm going to start to sweat. So what will help, actually, I more or less trap all this fluid there. I take the mask off, the mask is wet, and I probably do that. So that might be actually worse than having no mask.
Yeah. What would you suggest? I see some people are putting bandanas on.
I saw that yesterday at the store.
A friend of mine wears bandanas. Is that would still, well, I don't know, it's not going to stop the droplets, or would it stop it from penetrating if someone coughs on you? Would a bandana?
Yeah, but if someone coughs at you, yeah.
Just run.
Yeah.
Run, right?
I would not be worried. I would not wear any bandana, and I actually saw someone
Yeah,
yesterday in
I
the
see a
store.
lot of people
I
with
thought, is it
bandanas.
going to rob the store
I may have
or
one
whatever?
on one day.
Yeah, he really looked
At
very
least
worrisome.
we're not taking it from the supply chain of
Yeah,
that
no,
the
that's true.
hospitals need.
If you want to do that, I personally don't
If you
think
feel
it's
better. Well, I can't touch
necessary.
my nose and my
Yeah,
mouth, I think.
yeah.
And they said that's important, though. A lot of people do touch their face after they touch some surfaces. And you just said you are a culprit. I hope you don't get COVID-19, doctor. What else, from your experience as a epidemiologist, do you see how, we have places like the governor of California said he sees 25 million people could potentially get this in California, New York, and several other large states. So, California has 40 million people, and New York has 28 million. And if we don't do some of the precautions that they're doing, and have you seen, since the Spanish flu of 1918, which killed Woodrow Wilson, the president died from that pandemic, what do you think this could be as large as the Spanish flu?
So there are actually certain predictions which some of my colleagues who are much smarter than me did to think about the spread of the disease, and on their current estimate they assume that 40 to 70% of the global population at some point will be infected with COVID-19. Having said that, it's very important to think about 80% of these people will actually only have very mild signs and symptoms. They might not feel very well, they might be tired, like as Sean Payton and other people like that, but they really don't have to go to the hospital. So if you have mild signs and symptoms, stay home, self-isolate until your symptoms are over. Do not go to the healthcare, because again, we really only need to see the people who are really sick, might get a pneumonia or other issues, and we have to take care of them. So I think the main message is to not overwhelm the system, and that's when we are talking to flatten that curve. Social distancing, stay home when you're sick, or even like curfew or lockdowns. These are some of them very traumatic one, but these are public health measures which seem to work, so we have less cases. But people also, when I talk about flattening the curve, the problem is, if we make a curve flatter, you know what it happens. It takes longer.
That's right. And what do you think about, a lot of states are implementing telemedicine even more, so people can call in. People are afraid to death of this. A lot of people are saying, I'm a party anyway.
Yeah.
In fact, my roofer, I won't say what company it is yesterday, he didn't have a mask on, he had no gloves, and he's doing roofs and going around meeting people. And some people are not worried about it at all. And that really helps underprotect the rest of us when some people don't worry about it at all. But if they had I don't know if Louisiana has installed an 800 number of telemedicine where I've got a cold, I've got a temperature of this, should I come in? And that would stop maybe some of the ICU, the emergency room visits. Have they started that? Some states
they have a number 211 if we just came off I-10 from New Orleans. It's all over on the boards there to call them. What I would do if you're really worried, do not go to the emergency room, do not go to the hospital, call your primary care physician.
And they're getting overwhelmed too.
And they're getting overwhelmed. But again, just try to do not panic. Again,
this
most
211
people,
number is a telemedicine number?
I do not what the number is. Telemedicine is only actually done in certain hospitals. And I would assume they are actually overwhelmed at that point as well. But they might ask you, what are your signs and symptoms? Have you difficult breathing? Do you have an underlying conditions? Were you hospitalized before?
And that's really more
what is your
vulnerable.
age? So you really want to look at these people who really have to be in the hospital. And I think that's what we have to think about. We have to think about grandparents, other family members who are really at highest risk of severe disease and therefore death. Like as we have seen in nursing homes in Washington State and in New Orleans.
Yes. We're going to take a break and we'll come right back.
How do you see the world?
At Shriners Hospitals for Children, we know that changing how you see things can turn them into everyday miracles.
Like riding my bike.
Breaking boards. Hugging my mom.
Every day for over 90 years, Shriners Hospitals for Children has been sending love to the rescue, regardless of a family's ability to pay.
If you know a child we can help, call or go online now.
Thank you for coming back with us today with with Susan. I just want to call her
That's
Susan,
fine.
my friend here. And I think that she's given us a lot of good information about how to handle and where we think it may be going. If everybody plays their part, we have a quicker ability to flatten that curve. Do we have enough testing? And then we're gonna start closing it up, Susanne.
So we get more and more testing, the state of Louisiana, so that will be actually increasing again. They have now drive-through testing, as we have seen in other states.
Yeah, I saw one in Baton Rouge General. Right down, we're a block from Baton Rouge General Hospital on Florida. They have the big sign for testing there.
And I know the National Guard is also throughout Louisiana, at least South Louisiana, also do some more testing. Here, I think we really should focus on the people who have signs and symptoms, and again, when they drive through, might already have fever or other things like that.
Is it just people deciding, okay, I want to be tested, let me see, who may not even have signs and symptoms? There is no gate to say you can do it, everybody gets to do it.
Yeah, but what they really want to do, because we still don't have enough tests, it's really focus on the people who have signs and symptoms, maybe on healthcare workers, because you can just imagine if a healthcare worker is positive, then it can spread to the hospital, to really sick patients as well. And then again, to think about the elderly and the ones who are at highest risk. So I would advise everyone, even if you feel a little bit under the weather, what I would do, stay home, drink a lot of fluid, take some chicken soup, self-isolate from your family.
14 days in the
No, the 14 days is the maximum incubation period. So people
after you know you have it.
No, after you were in contact with someone, you had it. So basically that says it, like if I would have it today and I would call you tomorrow and say, listen, I was just diagnosed, I'm positive. So at that point, since you were exposed to me, you would have 14 days where you would actually then would be in quarantine to see
self-quarantine. You don't have to go anywhere.
Exactly. If you do not develop then the disease within 14 days, because that's the maximum incubation period, you're okay. I did not infect you. So the self-isolation is really for people who already have the disease.
A lot of doctors, I've heard some senators, a lot of dignitaries have
because they were in contact with someone who tested positive.
Well, they thought the president may have had it, but the person, he got tested and he does not have coronavirus. So we want to thank Susanne for coming up here today, and thank you all in the audience. And we want for you to pledge to us that you will take this serious. This is nothing to joke about. We've mentioned a lot of viruses in the world that have killed a lot of people. And just because you're young, don't forget, they are getting positive tests quite often, especially in the state of Louisiana. So let's not party on St. Patrick's Day again if we have a precaution not to party on St. Patrick's Day.